Thanks for staying with us at STL Live. I'm Jade, Harrell, and we're learning about the dangers of vaping and e-cigarettes with my guest, epidemiologist Neha Sastry of the St. Louis Department of Health. And it's Neha, not Neha, correct?
Yeah.
All right, I want to say it properly.
Thank
so
you.
we talked about the allure, and I'm seeing that a lot of young people are being drawn to the vaping. And I also wanted to add, are you adding now hookah to the list of dangerous things to do and warnings?
I think hookah is now becoming something that's more known as something that's not entirely safe.
Okay.
But of course, it does have a lot of people who really enjoy doing that because it is a community activity and a group activity that you can go out with your friends and do. So I don't know about hookah, but with vape pens, a lot of younger individuals have started using them. So I think that's probably why it's become so more pervasive into us noticing that it's causing some health issues.
For sure, when it starts affecting our youth and our children. Yeah. So the lure then for them are the flavors and the fun. And I noticed there's a new ban on flavored and marketing flavored e-cigarettes to young people.
Yeah, I think that's been something that happened recently. And also, I think it's mostly because these products that are being marketed can be manipulated by suppliers or by the users themselves. Right. Therefore, they're posing a greater risk to the users. So that's definitely something that's becoming more known to people and to health professionals.
Sure. The scientists are saying that they're not really sure what chemical or what is causing the illness or what's actually in what's being vaped that's making people sick. So is there a safe way at all? What if it's just water? Would that make a difference, or do you have a different advice for folks at all?
The CDC recommends that people stop using products entirely. There's no single product or substance that's been directly linked to vaping lung disease in the over 1,000 cases that are currently in the United States. So as I said, the CDC's recommendation is just to cease use of all products.
Who's getting impacted the most?
Currently, if you look at the patients that are being treated, 70% of them were male and 80% of them were below the age of 35. But if you look at all the patients as a whole, you see that their ages range from 13 to 75, meaning that just about anybody who uses these products can be affected by it.
So then what do we do for folks that want the sensation of, I guess, smoke or some sort of steaming? What would that be an alternative, or where do they go since this isn't it?
I don't know if there is an alternative. These products are causing a lot of issues among people. So ideally it would be the CDC's recommendation that people stop using them, especially ones that have nicotine in them or THC oils, because of the patients that are currently being treated with vaping lung disease, 78% of them reported a history of using THC-containing compounds, and nicotine, as we know, is addictive.
Absolutely. Do you have something to help folks get over their addiction to nicotine or to stop smoking? Since we thought vaping was the way, is there another way or method that's recommended to help people stop smoking as well as using nicotine in e-cigarettes?
I think ideally that would be something to talk to a medical professional about, especially if you think that you're experiencing symptoms that are consistent with the current outbreak. Definitely talking to a healthcare provider and trying to turn away from those vaping products would be ideal. For
sure. You said you studied St. Louis City and county, or city primarily?
Just the city.
You study St. Louis City's data. How do we look compared to other cities?
Well, as of right now, we've only had one death in the city the county. I'm sorry. The St. Louis County has had one death, and that's all of the deaths that have taken place in Missouri. Sure. So that's all we know right now, but it's a developing issue. So there could be more cases and more incidences along the way.
All right. Well, then, as we close, what will be the department's warning and recommendation? As we sum up, what are you saying we should do?
So right now it would be best if people stopped using these products and consulted a medical professional in the event that they're experiencing any symptoms.
All right, and maybe in the end, just don't try it.
It's possible.
Try something else, but what else is safe anymore? Thank you for being with us to help us learn more about this. The St. Louis Department of Health provides information on the dangers of vaping and more. For more information and to learn about their key programs and activities in the community, call 314-657-1568 or visit stlewis.org. mo.gov. There's more STL Live after this, so stay with us.